Hi, my name is Danny Hall, and I'm here to do the wound care video for Bates Technical College LPN program. The first thing I would do is the LPN steps outside of the room, get all of my stuff together, walk into the room, and then I would do my welcome steps. And hi there, I am Danny, and I'm here to do some care on your wound to clean that up for you and change the bandage. Is that okay with you? Great. Okay, so now I would do hand hygiene. I'm gonna go ahead and put my gloves on. Make sure that we've got privacy, which we do. And I'm gonna put the bed up at working level. Okay. I'm gonna go ahead and open this away from me.
Yeah, turn it around. And then pull like this. No, other way. No, turn it.
Yeah.
Turn. And then pull that back.
Towards you.
So that it's, yeah, so that you're not over
Not
it
reaching
at all.
it.
Perfect. Okay, so grab the red bag. Carefully. Open that up and it says fold back edges of a plastic bag to form a cuff and place within reach of your working area. This creates a place to collect contaminated supplies.
Okay, put that right
And
there.
then position patient comfortably but allowing access to the dressing.
Okay, I'm gonna take a look at this here and make sure all other areas are covered up from what I see.
Place waterproof pads under patient to catch any drainage and protect bed linens.
And I'm putting this under so that we can catch any kind of liquid that may run off on you. Okay.
That's what we do. Drape the patient to expose area of the wound, ensure modesty but facilitate care. Loosen the tape securing the dressing. Pull the tape toward the wound. Facilitates removal without separating the healing wound. Lift the dressing from the wound. Provide a barrier against contact with blood and blood substances. Hold on.
Okay.
Moisten the gauze with sterile normal saline if it adheres to the wound. Gently remove the wound packaging. Packaging should stick so that slightly to the wound is desirable so that it helps remove debris and dead tissue. Remove any packing material from tunnels as necessary.
Okay.
Pull off gloves over soiled dressing.
Gotcha.
So
Okay,
You
so
want
I'm
your-
taking a look at this in here. There's nothing that's sticking. I'm taking this out. That's what you meant, right?
and you would normally put all your sterile dressing in your glove, right?
Yes.
Okay.
I didn't put it all in there. I put some of it in there, but next time I will put all of it in
Okay.
Okay.
Don a new pair of clean gloves.
there. Okay, hand hygiene. And part of my welcome steps was identifying the patient with the two identifiers. That was covered already. Just want to make sure everybody knows that.
All right. Observe for any drainage from the wound. Note color, amount, odor, and consistency.
So there's no drainage. The color is red and beefy, which means growth. It looks good. There is a little redness on the outside here that I would note in documentation, but I don't see any other drainage or any holes, any pitting or anything like that, any tunneling.
Observe interior of wound for any blackened or yellow necrotic tissue.
No eschar, no black or necrotic tissue seen.
Properly healing tissue should be red and moist.
And that's exactly what it looks like.
Use sterile cotton-tipped applicator to measure depth of wound at its deepest point in centimeters. And you may want to push your sterile box back a little bit so that you're not over it with anything. Perfect.
So I'm gonna put this down into the wound without touching the wound to get the depth and come out, and I'm gonna measure that in centimeters. And it looks like approximately 3 centimeters deep.
And note measurement.
And I would note the measurement for documentation.
Use, yeah, perfect. And then with the other one, using sterile cotton tipped applicator, gently probe any tunneled areas within the wound and measure the length.
Okay, so I'm just gently probing. There's no tunnel areas within the wound. Everything looks good.
All right. Use a disposable transparent measuring sheet or other facility provided device. Measure the largest dimensions of the wound in both directions.
Okay. The length of the wound is 13.5 centimeters, and the width of the wound looks like about 2.5 to 2.5 centimeters. I did that without touching the wound, and then I would document all of that.
Perfect. You can put that over here if you'd like.
Discard.
Yep.
Okay.
So it says note wound edges for rounding towards the wound bed, which indicates healing.
They're definitely rounding towards the wound bed for healing.
Inspect skin around for evidence of inflammation.
There's no real inflammation. Like as I noted earlier, there's a little bit of redness around the wound that I would make sure to document. It could be just part of the healing process. I wouldn't necessarily assume that it's any type of inflammation or infection at this point.
Remove gloves. So, can you grab some tape, Chris? A different kind of tape. Don clean gloves.
Hand hygiene.
Hand hygiene, don clean gloves. And then your assistant's getting you a new
Oh, thank you.
tape. You're going to tear 4 strips of 2-inch paper tape, fold over each end to form a tab, and lightly stick them to the ends of the table. And I would recommend to the left side of the table since your sterile field will be on the
And
right.
actually, assistant, can you grab me a pen? I'm supposed to
You can just
put
send
my
it
name
in.
on it. On the tape, no?
Okay.
Thank you. Okay. Unless I'm confusing that with a different skill.
They put in a catheter, and she goes, oh, I remember the week.
Okay.
So strips should be long enough to picture frame the gauze dressing.
Okay. Cause then we get you. But we'll talk about that next time, next quarter.
I'd recommend the
side.
left side of the table, or left.
There you go.
Ah,
Assistant, we need a new tape.
I need a new tape. Thank you. Kinda wonder what a brand new one looks like. Most of these look like they're,
We'll never know.
I know. There we go. And I'm gonna put second one. So I just put the date and time and my initials.
Okay. So now we're going to create the sterile field.
Okay.
So you'll, there's no step-by-step.
Do I want to wash the wound first?
Not according to,
Put the sterile field together first?
yes.
Okay. Okay. All right. Here we go.
So you'll carefully grab your sterile field, move your box a little over to the left, and you're only touching the back side and the border 1 inch of your sterile field.
I just touched the middle.
Nope,
No.
you're good. 1 inch around and the very top, and then starting from the other side, lay it down across the table.
Does it go?
So closest to you will go down.
On the table.
So put it over the table. Nope, 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 nope. Go over the table with it to the other side, and then pull your hands to you to lay the paper down.
Don't touch it on yourself.
Perfect. Yep. And nope, that's the whole top. So push it forward a little bit so it will stay on the. There you go. You want it to stay down. Perfect. And, yep. And then you won't go over it or anything like that. And then what you'll want to do is grab the bottom of your sterile box, because that's perfect, very bottom. And from the very edge of your sterile field, don't hover over it, but from the very edge of your sterile field, so I would recommend with your left hand, pour the contents into your sterile field. Okay, and then put your box on the far side. So open a small bottle of saline, sterile, normal saline. Pour a small amount into the waste container to lip it, and then pour a small amount, and you don't have to actually pour, into that box.
Okay.
Yep, perfect. Don clean gloves. Never turning away from your sterile field and never hovering over it.
Okay. And these go from the back, okay?
Okay, so, I would have to just fold it. Down to that little bit space there. And then to the other side. And just bring it forward, please, ma'am. Now, on these, what you do is crisscross.
Okay, so now you're going to cleanse the wound with your antimicrobial agent.
Oh!
Yeah.
These are really big. Okay.
Perfect.
Right over there.
Over here. Oh, okay. Got it, like that?
And you're gonna just
Remember to go the same.
So it's this way.
Mm-hmm.
And we don't leave anything.
Using a technique that prevents transferring microorganism back to a cleaned area.
That way.
Perfect. You used a new swab cotton ball or gauze for each stroke. And then you allow it to dry, and now you can dispose of that, and you're going to don your sterile gloves.
So you can just have her come up, move forward.
And, yep, we did it on the very end of the table.
The key to this critical thinking is work.
This way.
Yeah, I would clear your table off so that you've got,
Can I throw this away?
nope, just move it a little bit closer
To the sterile.
to the back and to the right a little bit. There you go, perfect.
Okay.
And then you can actually throw that stuff away,
Okay.
And I'll see.
or discard them, whatever you wanna do with them.
Okay. Okay.
If you do it on the end of your thing, you won't compromise your sterile field.
Stand like this.
You're back to the white curtain.
Around to the
And I
end.
would just run this back. see
There
how
you go,
this
cause
is.
then you're facing your sterile field and then you won't
Okay.
touch it at all.
So.
Or crisscross.
Perfect.
Put it down.
Mhm. You can touch that inside.
Okay.
Well, she won't even, if you lean forward, she won't be able to.
Yep, and get rid of the other
Try to
package.
stand up.
This.
Yep, just drop it.
A little bit higher.
And you can get rid of the cup on to your left as well.
I just didn't know where to cross it.
Okay.
Perfect, now you're in business.
Okay.
Do you want steps for this or?
I'm
Got it.
hoping it's going to hold. So I can touch this one. Make sure that the cuff doesn't. Is that okay?
Yep.
Mhm.
These things are, you can tell that they're old. So I think that the cuff on the back side may have. Haha. So the thumb was caught up in the cuff. So the cuff on this side, I will notate that.
Okay, and
Lost
then
sterility.
you can fold your cuff on
Yeah.
that.
Okay. Now I can throw this away? Or does it matter?
Leave it there.
Leave it there. What's wrong? Should I get new gloves?
I don't know. Did you?
Yeah.
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 Let's
Okay.
do new gloves.
All right.
There's this set over
Do you want
there.
to pause it at all?
How do
You
I
can't
pause?
pause it, so
Okay.
I would just keep rolling and then grab
Okay,
your
just
set
size 9.
to right there, to your left. You
Oh,
have another.
okay. All right.
But don't break your sterile field either.
That's a 9, right?
Yeah.
Toss it in there?
Yep.
Mhm.
Toss that. Thank you. Let's see. Let me try those instead. Yeah. Can I do that?
Mhm.
Thank you. Okay, let's try this again.
Yeah, that's fine, because I'll pick it up on Friday. No problem.
You can fix it when you get your other glove on, but don't touch the glove.
Okay. I'm not. The inside I can touch.
Yeah.
Okay. Good enough for now.
There we go. Just pull it up, and then you can fix your fingers.
Yeah.
There.
Is that okay?
Yeah.
Mhm.
Okay. That's what happens when you have big hands.
Okay.
Yeah?
Perfect.
Okay.
Alrighty, so then you'll come back over to your sterile foil using forceps, cotton tipped applicators, or gloved fingers. Gently place packing material into wound.
Okay, so I can pick this up.
Mhm.
Mm-hmm. And move it.
Yep.
And then this.
And you want to make sure to get it wet in your
Okay.
container. So gently place packing material into wound, covering all tissue.
So I'm getting it wet.
It's okay, you don't have to. Yeah. And do not touch. Do not touch anything with your sterile gloves.
How was that?
Perfect. And then
So then I'm using one more. And I'm getting it wet.
yep. And do not not touch the bedding or the patient, and that's the two of them are gonna be okay. Let's see here. Continue to pack wound until filled with gauze.
Cover with 4x4s.
Yep. Do not force. Cover with 4x4.
Okay.
Yep. Perfect. And then apply the ABD dressing as an outer covering for dressing. Perfect. All right, and then you'll use your previously torn 2 strips of 2-inch paper to form a window frame around the outer edge of the dressing to secure into place.
You're no longer sterile. It's good.
Okay.
You're safe.
It's kind of like being on another planet.
Welcome back to Earth.
Just came back to Earth.
And then it says a facility policy recommends place your date, time, and initials, which you've already done.
These are the most horrific gloves. Okay. Because I'm not sterile, I can pull that down just a little bit to make sure that it's taped correctly.
Remove and discard gloves. Perfect. And follow end steps. So now you'll
Gather
you'll
my
get rid of
stuff?
all your supplies, throw all your supplies
I don't
away.
need gloves now, right?
Nope. And you'll follow your end steps.
Following my end steps,
That's it.
I'll dispose of the trash. Make sure the patient's comfortable, have the call light, lower the bed, remove privacy, wash my hands again, and document. Document.
And that is
that is
sterile
it.
dressing change with wound site assessment.